Okay, hi everybody. We're ready for the intubation. So I want to tell you a little bit about my role as the nurse. I am basically here to take the instruction from the anesthetist. So the anesthetist is going to ask me to do things. I need to stand in this position here, kind of facing the anesthetic machine, because at some point I'm going to be asked to perform cricoid pressure. And I need to have one hand to be able to assist them with taking packages off or removing dirty equipment, and come around here. Dirty equipment over here into the bin. I can't do this, okay? So one hand will stay on the patient, the other hand will be here, and the anesthetist will give me direction and they will do what they need to do. So Angelina, talk a little bit about this tray here and maybe some of the things that we might see on it as an FNC
So
nurse.
anesthesia has determined that this will be the tray that they're going to work from. This will actually come empty when it's opened up with just the K basin. They will put on the supplies from their cart, which is in the ante room. They'll decide which oral airway they will require, because they'll have an idea, you know, it's a female, or in this case, and typically maybe the green or the yellow one would be used. They will pick the endotracheal tube. They may choose a second one. If they pick a 7, they'll pick a 7.5 with a 7. They'll need a syringe. It'll have to be taken apart. It'll have to be tested. You'll have to have
And attached. I see that it's attached. That's really important, isn't it?
attached, yep, and also with the stilette inside, ready to go. The laryngoscope will be there, ready to go, waiting. These are just extras if once they get going and they need to monitor temperature. If they give them a general anesthetic, certainly if there was any contents in the stomach, that would be stomach. And this is just
And we have suction set up too,
and
right?
they have to clean their hands if they need to.
Okay.
So one of the things I'm going to ask you to do is I am going to ask you, and there's that suction, okay, so I'll leave that right there so you can find it should you. So I'm going to ask you, Lee.
Yes.
We have all the PPs on that you described initially. Again, for lack of it, we're just going to make you consider that we are
dressed
properly PP'd.
appropriately.
All right, can I get you to give the patient some oxygen?
Okay.
So my fellow colleagues from anesthesia have indicated that these patients will be well saturated. So it could be, up to even 5 minutes of just oxygenation. What they're going to try to prevent is bagging the patient at any cost, because the bagging of the patient at that point allows for the aerosolized contents from what's going into their lungs to come out and contaminate the environment. So they're going to do their best not to have to aerosolize the patient. So we're going to have the mask on, and you're oxygenating the patient.
An intubation is still an aerosolizing or an aerosol generating medical procedure,
And so
even without the bagging, right?
we would have again that full PPE with the N95, our mask, our shield, our 2 covers, the sterile gown, the yellow cover, the pair of gloves on top of the sterile gown, then covered with the yellow gown, then a pair of blue utility gloves, and that's how we would be waiting to accept this patient and ready for the intubation. Only 2 people in the room, okay? So you're oxygenating. So the doctor will then give the patient a cocktail of drugs. One, of course, will be propofol to put them to sleep, and then probably something like rocuronium to give them a muscle relaxant. What they'll do is they'll test the eyes and find out from the eyelashes whether they're asleep or not. I'll be asking you to apply some pressure. And then,
Cricoid applied.
and then what I'm going to do is I want you to think about it this way. Now, as we lift this up, this needs to go somewhere. It's now dirty, so it has to go onto the table. So please put that on the table. Thank you. And I'm going to now go inside. And I'm going to lift up. Okay, if you wouldn't mind taking that out, thank you. And I'm going to now place this inside. Still that out. Cuff up. And now I'm going to get you to take that off. So we're going to do this together in tandem. We're going to go right from the L, right at the L. Just take the mask off. Thank you. I'll take the angle.
Okay. Thank you for the direction.
That's okay. And we're going to hold this up, and you take that, so you can let go because I've put the cuff up. And I'm gonna be checking, I can now bag the patient, and as I bag the patient, you'll see the lungs are going up, I did a great job intubating. And I would be checking to make sure I have CO2, and it's telling me I don't have CO2, that's great.
And we can tell the surgeons to go ahead.
Yeah, so I have CO2, means it's in. I'm going to then take my tape, and I'm going to place this in its position.
And the surgery has already started.
And this will go on the eyes.
Okay, great. Thank you.